So this is chapter 21 on the blood vessels, and this is the second video for this chapter. And I'm going to go over blood vessels. And we're going to name some blood vessels, and we're going to look at the pulmonary circuit, and we're going to look at the systemic circuit. So first, let's start by looking at the pulmonary circuit. So we're going to draw the heart. So here's the right side of the heart. And then here's the left side of the heart. So I drew the right side of the heart in blue and the left side of the heart in red because I wanted to show where the deoxygenated blood and the oxygenated blood were. And then I'm going to draw the lungs. So we have the left lung right here with a little cardiac notch. And then we have the right lung right here. Okay, so let's take a look at the major blood vessels that we find in the pulmonary circuit. Coming out of the right ventricle, we have this big vessel here that's called the pulmonary trunk. And even though it's blue, it's an artery because it's going to be carrying blood away from the heart. Okay, so this blood here is moving away from the heart, and the pulmonary trunk then divides, and it divides into the pulmonary arteries. So the right pulmonary artery is going to go into the right lung, deliver blood to the right lung. And then we have the left pulmonary artery, and the left pulmonary artery is going to carry blood to the left lung. Now these arteries then are going to pass by these little alveolar sacs. Those are little air sacs called alveoli. And this is where the oxygen comes in when you breathe. So as it passes by the alveoli, oxygen moves into the blood vessel, and then the blood vessel then becomes, the blood in the blood vessel becomes a deeper red. And then we see that we have actually two blood vessels that return to the left side of the heart. And these blood vessels now are called the pulmonary veins. And they're red, but they're called veins because they're bringing blood back to the heart. Same thing on the other side. We see the blood that's coming into the lungs is called an artery, and they pass by those alveoli with oxygen. Oxygen moves into the blood vessel. Then the blood vessels the blood in the blood vessels become a deeper red. And then we have them split like that. And so we end up having two pulmonary veins from the right lung and two pulmonary veins from the left lung. And they're all going into that left atrium. Okay, so I'm not showing them here. They're going to kind of tuck right behind that, the heart there, and they're going to end up going into that left atrium. So this is the pulmonary circuit. So the arteries are blue in this pulmonary circuit because they have deoxygenated blood. And they leave the heart to go to the lungs, where they pick up oxygen, and then they return to the heart through the pulmonary veins. And we have the left pulmonary veins, which are coming from the left lung, and we have the right pulmonary veins, which are coming from the right lung. Now we're going to look at the systemic circuit. And we'll separate these out. First we'll look at the arteries, and then we'll look at the veins. So we're going to start at the heart because arteries carry blood away from the heart. So here we have the heart. There's the left side of the heart. And we have this big blood vessel right here that's called the aorta. So that's not actually labeled, but that is the aorta. Then the aorta has three branches coming off of the arch of the aorta, and we have to name each one of those branches. So the first branch there, that is called the brachiocephalic trunk. Okay, and then the second one right there, that one is called the left common carotid artery. And then that third one right there, that branch is called the left subclavian artery. All right, so let's take a look at the brachiocephalic trunk. The brachiocephalic trunk is going to divide, and its first division, we see it's going up into the neck there. That is called the right common carotid artery. And so that's going to go up and feed the brain. Then we have another branch that's going down into the arm. And so first, as it starts to go down into the arm, we call that the subclavian, the right subclavian artery. And I also don't see a line there, so that is the right subclavian. Artery. And then the right subclavian artery dips underneath the clavicle, and it starts to go into the armpit area. And as it goes into the armpit area, it's then called the axillary artery. The axillary artery then goes down into the brachial area of the arm, and then we call that the brachial artery. So we see that line there, that's the brachial artery. Okay. Then the brachial artery at the elbow is going to divide, and one of the branches is going to go on the thumb side, and we'll call that the radial artery, and the other one goes on the pinky side, and we'll call that the ulnar artery. So we have the radial artery, and we have the ulnar artery. Okay, we can see these on the other side too. So now the difference between the right and the left side is the right side had a trunk. So it had this brachiocephalic trunk. On the left side, there's no trunk. So those major blood vessels like the common carotid, the left common carotid, it comes right off the arch of the aorta. And then the left subclavian comes right off of the aorta. If you go back and look at the right side, the brachiocephalic trunk divided into the common carotid and the subclavian. So then the subclavian on the left side becomes the axillary artery, the left axillary artery, and the left axillary artery becomes the left brachial artery. And then the left brachial artery divides at the elbow to become the left radial artery and the left ulnar artery. So the aorta, as it's coming off of the heart here, so we see here's one line and here's another line. The aorta ascends, meaning it goes up, and then it has the arch where it arches around, and then it has this descending branch that comes down. So we can't see a whole lot of the descending branch. You can see a little bit right there. We can call that the descending aorta. And another name for the descending aorta would be the thoracic aorta. So we don't get to see much of that, but we do start to see the aorta again as it goes down into the abdominal area. So there's part of it there and there. And now, so it becomes the abdominal aorta after it crosses underneath. It goes right through this muscle that we call the diaphragm. And after the descending aorta pierces through that diaphragm, it then is called the abdominal aorta. So now we get to look at several branches coming off of the abdominal aorta. So first of all, we see that there is this these paired branches that are going into the kidneys. Those are called the renal arteries. So on this left side, that would be the left renal artery. And then on the right side here, that would be the right renal artery. There's also another branch that's all by itself here. You can see it right there. It comes off of the abdominal aorta too, just about in the same region that the renal arteries come off, and that is called the superior mesenteric artery. The superior mesenteric artery is going to go to the intestines and supply the intestines with oxygenated blood. So there's some other branches that we don't need to know about for this class, so we're going to just keep looking at the abdominal aorta. Abdominal aorta gets down to the pelvic region, and then it splits. And when it splits, the two branches that it branches into are the common iliac. Common iliac arteries. And so on the left side, we have the left common iliac, and then on the right side, we would have the right common iliac artery. Okay. Now, those arteries are going to split right away, and we're not going to have you know the names of those when they split. It's actually the internal and external iliac arteries. But then the external iliac artery is going to go past this ligament called the inguinal ligament. And as it passes through that inguinal ligament, then that artery has a different name, and now it's known as the femoral artery. So this is here. That would be the left femoral artery. And then over on the other side here, that would be the right femoral artery. So then those femoral arteries go down into the leg. They're going to travel all the way down to the knee. And at the knee then, they divide into the tibial arteries. So we have an anterior tibial and a posterior tibial artery. So this one right here is called the right anterior tibial artery. It's right in front of it's right on the front of the tibial bone. And then on the back side, we have the right posterior tibial artery. We can see that again on the other side. We have the femoral artery, gets down to the knee, and then it branches, and the branch in the front is called the anterior tibial artery, and the one in the back is called the posterior tibial artery. right? So again, this is the anterior. This would be the left anterior tibial. And the one behind, this would be the left posterior tibial artery. Okay. So I do want to show you this picture too, because we have a diagram that we're going to be using for our exam that looks an awful lot like this. So we're only looking at one side of the neck here, and these are the arteries. So this right here, as we're looking at this blood vessel coming up and around like that, that is called that's the arch of the aorta. And so we're only seeing the first branch that comes off of the arch of the aorta, and that first branch is called the brachiocephalic trunk. What you can't see are the other two branches coming off the arch of the aorta, which is the left common carotid artery and the left subclavian artery. So we see this brachiocephalic trunk, and the brachiocephalic trunk divides, and the first division over here, that will be called the right common carotid. Artery. And then the other branch coming off of that, that major branch there, that is called the right subclavian artery. And then the right subclavian artery will become the right axillary artery, which becomes the right brachial artery, which becomes the right radial and ulnar arteries. All right, so then that's it. Now that common carotid is going to come up and it's going to divide, but these are the only ones that you need to know for our exam in general A&P. So now we're going to take a look at the veins. These are the systemic veins. So we already talked about the pulmonary veins. We're talking about the systemic veins. So veins are draining blood back towards the heart. So what I want to do is look at the branches that are furthest away, and we're going to lead back up towards the heart. So first of all, we want to look in the arm, and we're going to see the radial vein and the ulnar vein. So we'll first label those. So the one on the thumb side, that one is called the left radial vein. And then the one on the pinky side, that's called the left ulnar vein. And then those are going to merge together to form this vein right here in the middle. And that vein in the middle, then we call the brachial vein. So that's the left brachial vein. The left brachial vein then becomes the left axillary vein. And the left axillary vein then becomes the left subclavian vein. And the left subclavian vein then is going to drain into the brachiocephalic vein. So that right there is the left brachiocephalic vein. So now we're going to see on the right side, it's identical to the left side. We have the radial and the ulnar veins draining into the brachial vein draining into the axillary vein, the axillary vein draining into the subclavian vein, and the subclavian vein draining into the brachiocephalic vein. So you can go ahead and label all of those. Now, I am going to label the right brachiocephalic vein, which is right there. And you know what, let's just go ahead and label everything else. So that's the brachiocephalic right there. That's the right subclavian vein that comes right after the brachiocephalic vein. Then we have the axillary, so the right axillary vein. Then we have the right brachial vein. Then we have the radial and the ulnar veins. It's so much easier to see the ulnar and the radial veins on this side of the body, on the left, because that hand is in the anatomical position, so then you can really see which one's the radial and which one's the ulnar. So that would be more likely where that would be tagged on an exam. Okay, so now let's go back and look at those brachiocephalic veins. Those two brachiocephalic veins are going to drain into that superior vena cava. The superior vena cava then drains into the right atrium. So that right there is the superior vena cava. In the next picture, I'm going to take a closer look up here so that we can see what other things are draining into that brachiocephalic vein. There's blood vessels that you need to know. So we have the internal jugular vein. And we have the vertebral vein. And we have the external jugular vein. And all of these veins are coming from the brain. So they're draining the brain, and they're all going to drain into that brachiocephalic vein. So the next picture that I have has a much better view of that, a closer up view. And the same exact thing would happen on the right side, where you'd have the internal jugular vein, the vertebral vein, and then the external jugular vein, all draining in, and the subclavian vein over here. So all of them are going to drain into that brachiocephalic vein, which drains into the superior vena cava. All right, now let's take a look at the lower extremity. In the lower extremity, we have the anterior tibial vein and the posterior tibial vein, and they are draining into the femoral vein. Okay, so let's just draw those, label those. We have the anterior tibial vein, and we have the posterior tibial vein, and we have the femoral vein. Okay, there's another super long vein that's going to drain into the femoral vein, and that's called the great saphenous vein. So we can really see it on this side. It's called the great saphenous vein. And we can see that it goes all the way down the inside of the thigh, and it comes all the way back up, and then it drains into the femoral vein. So we see it on this side here, but we just, with those dotted lines there, it's kind of showing you that they cut it off, even though it should go all the way down. But that comes up and it drains all the way into that femoral vein. Then the femoral vein will drain into the pelvic cavity and will become up a little bit higher. It will become the common iliac vein. So we've got the left common iliac vein, and then on the other side we have the right common iliac vein. Right there. And then they drain into the inferior vena cava. So draining into the inferior vena cava, we have some other blood vessels. We have the blood vessels that are draining the kidneys, and those are called the renal veins. So we have the right and the left renal vein. So here's the left renal vein. And the right renal vein is at the same location on the opposite side, and they're just draining the kidneys. And those are the only branches that we need to know of the inferior vena cava, other than there is a vein that we're going to look at in the abdominal pelvic area that doesn't drain directly into the inferior vena cava. Instead, it's draining blood from the intestinal area and going straight to the liver. So we're going to look at that on another picture too. So these are the veins that you need to know in the systemic system. So this is showing the right neck, right side of the neck, and we're going to take a look at the different blood vessels. So right here, this one is the superior vena cava. And the superior vena cava is draining into that right atrium. And draining into that superior vena cava is the brachiocephalic vein. So this would be the right brachiocephalic vein. So now we want to look at all of the veins that are draining into the right brachiocephalic vein. So we have this vein here that's coming from the inside of the head. So it's coming in from the brain. You can actually see the branch as it's coming down through that foramen magnum and then coming down into the neck area. And that is called the internal jugular vein. The next vein that's draining into that brachiocephalic vein is the one that's going down through all those transverse foramen of the cervical spine, and we call that blood vessel the vertebral vein. So since these are on the right side of the neck, we're going to call them the right. So we have got the right internal jugular vein. Now we have the right vertebral vein. And then next we have this other vessel here. This is the external jugular vein. Now you can see that these blood vessels are actually coming from blood vessels, veins that are going on the outside of the skull. The internal jugular was from the inside of the skull, and the external jugular is from the outside of the skull. And we can see that it's draining down into that vessel down there. And so that we call the external jugular vein. And since it's on the right side of the neck, we're going to call it the right external jugular vein. All right, now let's see this other vessel here. So this blood vessel right here is draining blood from the upper limb, and all of these other blood vessels are joining that blood vessel. So the external jugular vein, the vertebral vein, and the internal jugular vein are all joining that vein right here. This vein is called the subclavian vein. And it's the right subclavian vein. And so they're all joining. So here's the right subclavian vein, here's the external jugular, here's the vertebral vein, here's the internal jugular vein, and they're all draining together to form that right brachiocephalic vein. And then the right brachiocephalic vein joins the left brachiocephalic vein to become the superior vena cava. One way that I memorize this is by looking at the first initial of each of those blood vessels. And so we've got the internal jugular, so I, vertebral vein, V, external jugular, E, and then subclavian, S. So that would spell I, V, E, and then S. So Ives. That's just one way that you can memorize it. Of course, it's going the opposite direction, right? This way. Internal jugular, vertebral, external jugular, and subclavian veins. And and those are draining into that brachiocephalic vein. And lastly, I want to show you this picture. It's the last blood vessel that you need to know for the veins. And so just so you can get an orientation here, this is your colon. So this is your large intestine right here, otherwise known as your colon. All of this whole thing there. And then we have this here is your small intestine right there. It's kind of curling around. Right, so there's your small intestine. And that's leading into that large intestine. And the vein that you need to know on this picture is this one here. So this one is called the superior mesenteric vein. And it's not really draining into any of the blood vessels in the systemic general circulation, but it is draining into the hepatic portal vein. So this blood vessel, I'm going to draw a line from that. That's called the superior mesenteric vein. There's only one of those, so we don't have to say that it's right or left. There's just one superior mesenteric vein. And that superior mesenteric vein joins up with the inferior mesenteric vein, which we don't need to know for this class, but they drain into the hepatic portal vein, and then the hepatic portal vein goes into the liver. So hepatic is another term for liver. Then that's it. That ends that little portal system, and from there then there will be another vein called the hepatic vein, which will leave the liver, and it will drain into the inferior vena cava. All right, so those are all the blood vessels that you have to know for your lab exam, and there will probably be some questions on the lecture exam as well.